Welcome to the Jeremiah Show, Grown Man Speaking. Allow yourself to listen with intention.
Welcome back to the Jeremiah Show, Grown Man Speaking. Today, we have an intriguing topic lined up that's generated a lot of buzz recently. GLP-1 weight loss drugs. And to help dissect this complex subject, I'm thrilled to have Pavel on with us. Pavel, thanks for joining the show.
Thanks for having me, Jeremiah. It's a pleasure to be here to unravel this topic that seems to be on everyone's lips these days.
Absolutely, Pavel. It's fascinating how quickly these GLP-1 receptor agonists, initially developed for diabetes, have entered the weight loss conversation. For our listeners who might not be familiar with GLP-1, let's lay down the basics. Could you explain what GLP-1 is and how these drugs work?
Sure. GLP-1, or glucagon-like peptide 1, is a hormone released in our gut when we eat. It promotes insulin secretion, inhibits glucagon release, slows gastric emptying, and importantly, sends signals to the brain to induce satiety. When mimicked by medication, it essentially helps control blood sugar levels post-meals and can induce weight loss by reducing appetite.
That sounds comprehensive. I remember the days when gastric bypass surgery was all the rage for sustainable weight loss. It's quite a shift to see pharmacotherapy at the forefront of weight management nowadays. What are your thoughts on how these drugs compare to more traditional weight loss methods?
Well, traditional methods like surgery and lifestyle changes absolutely have their merits. Surgery leads to drastic weight loss, but it comes with its risks and recovery period. Lifestyle changes have a lower risk profile but often face adherence issues. GLP-1 drugs offer an alternative that's less invasive than surgery and can be quite effective. Some studies show that patients can lose 5 to 10% of their body weight, which, in turn, greatly reduces the risk of other obesity-related health issues.
Interesting. But as we know, with every medication, there's always the question of safety. What are some of the known side effects, Pavel, and how safe are these drugs for long-term use?
The primary side effects revolve around gastrointestinal issues, such as nausea, vomiting, and diarrhea. However, these can lessen over time as the body adjusts. For long-term safety, there's still ongoing research. We don't fully understand the impact of these drugs used specifically for weight loss over many years. However, the data from diabetes management, where they've been used for a longer time, doesn't show alarming long-term risks.
Right. It's always crucial to keep an eye on those long-term studies. Now, let's talk about the real-world implications. Who should ideally consider taking these drugs, and who should be cautious?
That's a great question. These drugs are particularly recommended for individuals with a BMI over 30 or over 27, with a weight-related comorbidity like hypertension or type 2 diabetes. They're not meant for someone looking to lose a few pounds for a wedding or a summer body. And of course, anyone with a history of pancreatitis or medullary thyroid carcinoma would need to avoid them.
That makes sense, Pavel. But, with new drugs comes a rush of enthusiasm, perhaps even misinformation. Are there any misconceptions you've noticed about GLP-1 drugs that we should address?
Definitely. A big one is the belief that these are magic pills. Weight management is multifaceted. While these drugs can aid weight loss, they work best in conjunction with a healthy diet and exercise program, and won't solve the root causes of weight gain alone.
Exactly. I think it's critical for our listeners to appreciate that kind of context. Now, let's pivot slightly to a broader view. With so many people looking for effective weight loss solutions, do you think the increasing popularity of these medications signals a shift in how society approaches weight management?
In some respects, yes. Modern medicine is finally recognizing that obesity is not simply a result of lifestyle choices, but a complex interplay of genetic and environmental factors. By considering pharmacological options, we acknowledge the biological aspects of weight gain, which might reduce stigma and encourage a more holistic and empathetic approach to treatment.
That's such an important perspective, Pavel. We might even see a shift towards more personalized medicine in weight management. But with this personalization, are there ethical considerations we should be mindful of?
Absolutely. There are concerns about accessibility. These drugs can be quite expensive without insurance coverage, creating a disparity in who can access effective treatment. Plus, as more people turn to these drugs, there's a potential for new regulations and insurance complications that could limit access further.
That's true. And pharmaceutical pricing is a whole other topic that could take up an entire episode. Let's round off with thinking about the future. Pavel, where do you see the future of weight loss treatments heading?
The future is promising. I believe we're moving towards more targeted therapies that consider individual genetic profiles. As research advances, we might even see novel treatments that address the neurological drivers of appetite and metabolism, offering more tailored and effective interventions.
That's an exciting future to contemplate. I think for many people struggling with weight, these innovations bring hope. Pavel, I can't thank you enough for bringing your wealth of knowledge to this conversation. It's been enlightening.
Thank you, Jeremiah. It's been a pleasure discussing these important issues with you. I look forward to seeing where these discussions lead as the science progresses.
Family, if you've been rocking with the Jeremiah Show, Grown Man Speaking, then you already know this podcast is about real talk, real growth, and real men becoming better every day. But this movement only grows when we grow it together. So if you value the game, the honesty, and the wisdom we drop here, support the show by grabbing the paperback, the ebook, or the audiobook. Every purchase helps this platform stay independent, stay authentic, and stay speaking to the men who need it most. Hit the link, get your copy, and keep the conversation going. Grown Man Speaking. Listen with intention.
And to our listeners, thank you for tuning in. Be sure to stay informed and talk to your healthcare provider if you're considering new weight management strategies. We'll be back soon with more thought-provoking topics. Until then, stay healthy and take care.
Thank you for tapping in to the Jeremiah Show, Grown Man Speaking. Until next time, move with purpose and listen with intention.